Today I want to talk about a subject that concerns a lot of patients who come into our clinic at Dr. Spine, and that is headaches, in particular migraine headaches, and how you get migraine treatment in Bangalore. Most people who come in to us at Dr. Spine talk about having migraine headaches, and when I ask them a few questions, I find that some do have migraines, and they know what it is. Other people have what they consider to be bad headaches, but they're not migraines. So I wanted to clear up a few items of concern for most people and go over ways that we can treat all of these types of headaches to your satisfaction. So the first thing to realize is that I myself had headaches for 30 years. So I consider myself somewhat of an authority on this subject because I was able to cure my headaches, able to find the solution to my problem, and so I feel well qualified to help others find those solutions as well. Now I want to cover a couple of things about the different types of headaches, for example. Migraine is a type of headache, something in the metabolism is not quite balanced out, and it affects the so-called dura mater in the brain. In other words, there's a covering around the brain inside the skull called the dura mater that when this gets inflamed, it can create this tremendous headache. Both migraines and something called cluster headaches involve the inflammation of the dura mater. So I'm going to talk about those in particular. Now, when a migraine happens, it starts as a subtle aura. In other words, you know what's coming. People who have migraines report that they have a pre-warning. In other words, this aura is started, this feeling that something is growing. They don't feel quite right in the morning. Suddenly, bright lights affect them. Loud noises affect them. They can't be around other people. They can't focus. They can't concentrate. They have to lie down. They feel nauseous. They feel not themselves. And then the pain, the pounding begins, usually on one side of the head or the other. That's the definition, the classical definition of migraine. There are other types of headaches just as severe. Usually those are classified as cluster headaches. It feels like a migraine, or it's as intense as a migraine. People talk about these types of headaches as migraines, but the classical definition doesn't fit. However, splitting hairs doesn't really matter. These types of headaches are very painful. Now, as a doctor, I need to define what headache is, and I need to define what type of headache you have, simply because it helps me to narrow down and find out exactly what the cause may be in your particular case. Cluster headaches and migraines are very similar, so I'm going to talk about these in particular. But there's a couple of other headaches that I wanted to cover, and those are simple headaches. In other words, a strain or sprain in the neck. For example, you had an accident, a whiplash injury, something to where you fell, something to where you feel maybe you've been working too hard, sitting at a desk too long, and there's a strain in the upper neck, and you feel this headache coming up. Now, those types of headaches are fairly easy to resolve with chiropractic. This chiropractic adjustment will help to realign the muscles and the bones in the neck to help bring about relief. And usually the relief happens fairly quickly. The other type of headache is a sinus headache, where you're mostly going to feel headaches behind your eyes, in your forehead, and in the area of the sinuses. These types of headaches usually relate to dietary concerns. They also relate to allergies. If you have particular allergies, say allergies to ragweed or allergies to flowers or trees or grass, or you may have allergies to anything. Some people have allergies to rubber or plastic or different types of things, peanuts, any types of food can cause allergies. All I know is that if you have food allergies or you have any types of allergies, usually the symptoms and the headaches will come either later that day or during the night and early the next day. So you can look at your diet, look at your surroundings, find out what could be causing the headaches. It could be your home. Some people are allergic to their homes, or the dust, or mildew, or mold. Anything could be in the house that's causing these types of headaches. So sinus headaches generally require that you go to the source, that you find out what's causing the pain, and you get rid of that source, and you feel better. Chiropractic can still help with these types of headaches. Just come in, get an adjustment. We can also test you on different types of allergens, things that may be causing the problem. Sometimes we can get to the root of it. Sometimes it's going to take a little work to find out what these are. In any case, I suggest that you come in for chiropractic adjustments for headaches. If for no other reason, then I can examine you and find out whether or not you have this type of headache or another type of headache, so we can get to the root of it. When we're talking about headaches, we're talking about 3 different causes for headaches. The first is physical. This is fairly well defined. In other words, you had an auto accident. You fell off a bike. You fell off out of a tree. You hurt yourself. You sat at a desk for many years and 10 hours a day doing this work on a computer. You have a physical cause of your headaches. Now, physical causes for headaches are fairly easy to correct. We just need to correct your spine, give you some tips on how to sit, how to carry yourself, how to walk, give you some exercises that can help resolve these issues. But the primary problem is that you have a misalignment in the spine. Chiropractic can help correct these misalignments, called subluxations, something that's slightly misaligned but is causing an irritation in the spine. So chiropractors correct subluxations. The second cause of headaches can be chemical, a chemical reaction that's taking place in your body. You might have some neurotoxins. You might have some fungus, some mold, something that's happening in the body that's causing these types of headaches. Maybe you're taking some medications, or it could be the dust in your house. It could be anything that's affecting the liver and the gut. Now, both the liver and the gut are very sensitive. They're going to pick up on these types of toxins and poisons, and they're going to react. And this reaction can cause neurotoxins to go throughout the bloodstream and affect the bloodstream, and therefore it's going to circulate also in the brain because the brain gets a lot of blood supply. Chemical causes can cause headaches. The third cause for headaches would be mental emotional. Now, I can address this one because I had a mental emotional cause to my headaches, which began over 30 years ago when someone very close to me committed suicide, and that was quite a shock to my system. Soon after I felt sick, I also started getting these headaches, either weekly or bi-weekly. But the headaches began and they kept coming. Sometimes they would come every day. These headaches were very intense and they lasted a long time. So the death of a loved one, a breakup of a relationship, or a job change, some of these can trigger headaches. And these disturbances also lead to chemical changes that go back to the second cause, can also be contributing to your headaches as well. At Dr. Spine, we address all 3 causes of headaches and can either adjust your neck and the spine to help with these problems or refer you to sources that can give you some permanent care. Come see us at Dr. Spine. I'm Dr. Michael Craig. I'm a chiropractor. I've been a chiropractor for over 35 years, and I'll be happy to work with you.